Our next talk is from Dr. Debasish Bhattacharya. He's going to be speaking on being affordable in eye care delivery.
Good evening, everybody. Being affordable is a wonderful thing. And Bhujang, sorry, without slides today, you are not a speaker really. That's what system and technology has paralyzed us to. So essentially, when we go out to serve patients, this is the first question every doctor asks. What does the patient want? Well, to be honest, he wants everything. He wants the best chair time, the best doctor at the least in his most convenient time. But the most relevant question lies that what is he actually willing to pay for? So it is a journey from where we take affordability first and bring him to aspire the entire community and a patient as such. Now, we have wonderful stats from the industry around the affordability and whom we need to focus on. So almost 35 lakhs of our 65 lakh cataracts are lenses below 200 rupees. So essentially that matches with the per capita monthly income. Now, the next category is another 40%, which fits into a per capita monthly income of 8 to 24,000. And then comes the premium group, and this adds to the total. So if we really want to be, where would we like to place ourselves? I think a very strategic and choice would be to be around here, because it would allow us to go both ways and definitely be very relevant in a private practice setup scenario. Now, if we take the anti-VEGF injection market, I mean, it's from the industry, we see that we just do 3.3 lakhs. It's only 1/20th of our total cataract volume, but in the Western world, it's 1 to 2 times of the cataract surgery, which says how little we have percolated into comprehensive eye care down to the last mile or the last person. So essentially, there is a huge scope of improvement at that. And here, this also points that because these injections are costly, the treatments are probably deferred, denied, or not accessed to. Now, if we say fair price, now obviously a fair price and a transparent way of providing it definitely brings in the faith that Bhujang was talking about. And this faith, once coming into the institution, he knows about newer things, and that aspires him to a higher level of care acquisition. And word of mouth publicity is perhaps what we get from a happy patient. And that is perhaps the strongest marketing, and of course becomes very relevant for a social marketing point of view. Now, this starts the inclusive ball game. Otherwise, we, as individuals, we try to be exclusive, and it gives us a very quick break even in private practice and the opportunity to scale. And we can improvise to improve technology, systems, and the entire value chain with the human resource, the empathy, and carry forward the building up an organization and the ability to replicate and perpetuate, which obviously is a goal of any hard work. So pricing considerations, we would consider how to price your services. Most of us end up doing shadow pricing. Location, we would say it should be 3 times, a cataract surgery should be 3 times the square feet cost of the residential, standard residential area. The segment we want to serve, the first thing we understand is the staff should avail a standard treatment in that hospital where they work. And we would pay the OPD expenses as 1 day per capita is a standard OPD expense. And we should understand that any discounts, free service, training which is not consumed in the practice, is an expense and should be, paid, should be made provision for. And lower the price, better will be the compliance is obvious, and the price can obviously be escalated through economies of scale, and costs can be reduced by converting fixed into semi-variable costs like part-time consultants, buying equipments in EMIs or bundling equipments, etc. And the price changes should be incremental. So having said that, this is how our scenario works out, and our average cataract surgery price is 17,000, and the average OPD spend is around 720 per patient. So the vision at operation hasn't quite improved over the years, as you see, and the cataract surgical rate. So that is why we say that probably we have done much more in the cataract segment than probably was expected. The economies of scale work like this, that the doctors don't want to do IO. Now, if a 500 patients a day hospital buys OPTOS, we can offer it at rupees 300 and still be relevant. And it gives better compliance, better peripheral lesions. So we can afford laminar flow theaters. So this is how our journey went on over the years, where we just moved on from one hospital to the other as we got 550 patients from geography. In the rural or some semi-rural belt, it would be around 100 kilometers, and in the urban area, it would be around 25 kilometers. So this is how we branched into 15 hospitals over the years, and we took affordable eye care to our patients. So having said that, this has been our growth in the OPD, and this has been the IPD surgery stats, and this has been the COVID year is shown we have 20% deficit. This is what we want to do in future, and we would conclude by saying that low cost is not low quality. When you focus on quality, you pick up means where you can give quality at low cost. And thank you very much for your attention. All lies in simplification that we reach this point. Thank you very much.
Thank you very much, sir. Any modifications you made during this pandemic? I mean, like everywhere, there's been a down in the OPDs as well as the surgeries as well. So, but when you have to pick the big staff.
One thing we didn't do is we didn't close our hospitals, any of these hospitals, for even a day. Right. And teleconsultation was a new platform for us. We started it. Of course, in the month of March, I think or April, we did only 29 lakhs. So, yes, it was very bad, but I think there is a lot of, pent-up demand waiting in the lines, and it will come back as things normalize. So
I'm sure. Thank you very